Hi, I'm Angeline Pasha. You can call me Ange. So my pre-med course was MedTech. I also did my residency in ophthalmology. So why ophthalmology? Vision isn't just about reading or being able to see a chart. It's about grandparents being able to see their grandchildren clearly. It's about individuals having the ability to drive or to perform activities of daily living independently. So whenever I help patients or whenever we help patients regain their sight back, we're not just giving them their sight, we're giving them back their confidence, their individuality, and their independence as well. And that's very fulfilling. 3 words to describe my residency. So first is humbling, challenging, and inspirational. So a day in the life as an ophthalmology resident. So we usually begin our day pretty early, around mga 6:30 kailangan nandun na kami para set up na ng OR. So yung OR cases naman, relatively quick, around 15 to 30 minutes. So this allows us to do multiple cases in the day. After which we proceed to the OPD charity clinics wherein we see our patients. In between also, we do laser surgeries and other procedures at the eye center. The day usually ends at around maybe 4, 5 p.m. Minsan napapaaga, minsan napapalate. Depende din yun sa patient load and yung schedule for the day. After which, pagkagabi, around 7, 8 p.m., we begin our inter-hospital rounds, subspecialty didactics, lectures, and minsan may journal club as well. Usually, academe naman siya sa gabi, wherein every resident is required to attend, minsan face-to-face, minsan Zoom lang naman usually. So, relatively manageable naman siya. Siyempre, even the duty residents have to come in and be present during the lectures. Speaking of the duties, yung duties namin, every 5 or 6, depending on the number of residents present. So, which means, kapag duty ka na ng Monday, yung next mo is usually Friday na or Saturday. And then pag weekends, we usually have our research writing, journal clubs, and the like. So the most challenging part of my residency training, I would say that, syempre since microsurgery siya, we're doing things underneath the microscope, all your movements are gonna be magnified. Doon ako medyo talaga nahirapan kasi syempre grossly, hindi naman nanginginig yung kamay ko, pero bakit sa microscope, galaw na galaw siya? Bakit ang hirap? Bakit ang friable ng tissue, ang thin, ang delicate? Pero syempre, yun nga, learning curve siya, muscle memory, once you learn it, you get it. And I'm very lucky na yung mga consultants namin, they're there every step of the way. Pagka syempre, madadown ka, first few surgeries mo, hirap ka, they're there to cheer you up, they're there to mentor you, they're there to correct your hand position, your pose, para to improve ka din. And syempre, yun nga, once you get it, you get it. And the most rewarding part of it is, imagine having a patient who can barely see, hindi makakita, kinakapa lahat, hindi siya makalakad by his own, naka-wheelchair pa nga minsan. Tapos after the surgery, immediately after, minsan nga, pagkatanggal mo nung drape, sasabihin ng pasyente na parang, Dok, nakakita na kami, nababasa ko na yun. Tapos parang, you realize na yung debilitating situation nila, akala mo, nirarayo mo or akala mo hindi na makatayo, hindi na makalakad, maka-ambulate. Yung pala, hindi lang nakakakita. And then the next day, the relatives, they're gonna follow up. Kasama nila yung grandparent or yung patient. Sasabihin nila parang, Dok, nag-iyakan kami sa bahay. Nakakita na si tatay, si nanay. That part talaga, very fulfilling. Very, very fulfilling. Ang sarap ng pakiramdam, ang sarap sa puso na babalik sila sa'yo, na natulungan mo sila. Personally din, naka-experience din ako ng ganun kasi ako dati yung vision ko was around 800, 850 na myopia. So ako pagka wala akong salamin, hindi na ako makakita to the point na minsan pagka-duty ako, nakatulog ako. Pagkagising ko, hindi ko na alam kung nasan yung glasses ko. Hindi na ako makakita. Literally, kinakapa ko na siya. So, I underwent LASIK surgery for myopia. Tapos, it gave me back my vision, it gave me back my confidence, and ganito pala yung feeling na 2020, kitang-kita mo lahat. So advice to anyone who wants to come in the field of ophthalmology is to start early. Expose yourself to the different ophthalmology clinics, do observerships, ask questions, watch surgeries, and make the most out of your clinical and postgraduate internship rotations. No, always be curious, stay humble, and always remember na it's not about lifestyle or work-life balance. Ophthalmology is about restoring a patient's vision, improving a patient's quality of life and independence. And, just keep trying. Just keep trying, just keep striving. And, nothing worth having ever comes easy. So just try and do your best. And hopefully, there's gonna be light at the end of the tunnel.